It's my pleasure to welcome you to our session today, Putting Lean into Practice for Businesses in Low and Middle Income Countries. I'm Heather Esper, Director of Performance Measurement and Improvement at the William Davidson Institute at the University of Michigan. Today, we'll be talking about a practice Toyota pioneered in the 1950s, which has since been adopted by manufacturers around the world. But lean doesn't just apply to manufacturing giants. The methodology is just as valuable to businesses of any size and sector that have processes, whether to manufacture a product or deliver a service. Today, my colleagues Johan, Yakuta, and I will provide an overview of how the Toyota production system lean thinking can be applied with businesses in low and middle income countries to improve processes and reduce waste. We'll share how to empower your company with lean tools and data to strengthen problem solving and bottom line performance. So throughout the presentation today, please pop any questions you have into the Q&A function, as we've saved time for us to answer questions live at the end of the presentation. Before we get started, we wanted to understand how familiar you are with lean thinking. So we have a poll question that we want to ask. If you could just answer that, will give us as presenters a little bit more intel into how familiar our audience is with lean. Okay, cool. So about half of our participants that responded have heard of lean tools such as value stream mapping and A3. For a quarter of them, it's all completely new, and then a quarter of you have used lean tools such as value stream mapping and A3s in the past. So before we jump into sharing more about lean, we first wanted to share a little bit more about ourselves. At the William Davidson Institute at the University of Michigan, unlocking the power of business to provide lasting economic and social prosperity in low and middle income countries is in our DNA. We work across a number of areas listed on this slide in the hexagons, as well as manage Next Billion and WDI Publishing. Through research, education, and consulting, we gather data, develop new models, test concepts, and collaborate with partners to find real solutions that lead to new opportunities. This is what we mean by solving for business. Our calling since the Institute was first founded as an independent nonprofit educational organization in 1992. We believe that societies that empower individuals with the tools and skills to excel in business in turn generate both economic growth and social freedom, or the agency necessary for people to thrive. Our performance measurement and improvement team designs and implements customized assessment solutions to understand economic, social, and environmental outcomes in order to improve operations in real time. We work with partners to develop and implement impact measurement, continuous improvement, and knowledge management systems to create innovative and impactful products for decision-making and dissemination. We have extensive experience with qualitative and quantitative data collection and analysis in complex environments with different sized businesses around the world. We also provide capacity development and training for small and medium-sized enterprises and other stakeholders. Now I'll turn it over to my colleague, Johan, to introduce himself and the healthcare delivery work we're doing at WDI.
Thank you, Heather. In the healthcare delivery part of the Davidson Institute, we provide consulting to a wide variety of healthcare organizations based in low and middle income countries. And one aspect of that consulting is a series of modules that we've developed as a growing training course for healthcare delivery management. So typically the participants in these courses are hospital executives and managers at private hospitals and sometimes outpatient facilities also in low and middle income countries. And we cover areas such as operations, finance, strategy, and corporate governance. The operations part is particularly relevant to today. Within that, we've got a course that we've run now a few times that has two modules within it, one on process analysis and optimization, and we'll show you a little bit more of that later on in the presentation today. In that, we talk about how to map, analyze, and improve patient care and other processes. The graphic on your right there alludes to that. So you start with a process, how it is today, you analyze it, you figure out ways it can change, and you come up with a new future process referred to as the 2B process. We also teach how to apply an accounting technique called time-driven activity-based costing. It's an accounting methodology, I should say, which enables you to assess the costs of delivering whichever patient care process you've analyzed in the process analysis and optimization. And such process mapping and costing are also integral parts of lean methodology. So we'll be illustrating that aspect for you today. Thank you. With that, I'm going to turn over to my colleague, Yakuta.
Hi, everyone. It's very nice to meet you all virtually, of course. And I just wanted to say a big thank you for your time and your attention. So the best way to get started is to tell you what's the benefit and value to you and to your organization, right? So that's what we're starting out with, is what are the benefits of lean thinking? So let's dive right in. Lean is, but first, the definition. So lean is a rigorous data-centric approach to developing and improving products or services and your operations. Over the next few slides, we will discuss the types of data and the lean thinking tools used to collect, organize, and analyze this type of data. But for now, this is the key message, and that's what this is. Lean is a systematic approach steeped in data to optimize business processes and create value while eliminating waste. And we're going to go through each of these words. So there are various benefits to applying lean thinking. The first one we want to call your attention to is the increased customer satisfaction because of the focus on creating value for customers. This is done by better understanding what customers need and what value means to them, which is the data collected through the concept or during the concept and design phases. It also includes collecting feedback from customers once the product or service is out in the market. And we have a sample indicator for you towards the end of the presentation on this. Tied to this is the second benefit of improved quality of the product or service produced because it is so closely matched to what the customer wants. The next two benefits are also linked. You have reduced product or service time to market and reduced costs by eliminating waste. Now, this is done by understanding the process through value stream and process maps and other such tools, identifying the bottlenecks, which we'll get to in a second, and understanding why they happen through various root cause analysis, such as the 5 whys, and finding ways to reduce the waste, which we will also talk about in the next slide because waste is such an important concept in lean. The next benefit focuses on your team. It's about empowering your team and empowering leadership with tools and data that they can use to create better processes and products. And a final benefit that we will leave you with today is that lean allows you to adapt quickly to changes in the market because of the focus on data and continuous improvement. So the real-time data that you collect then signals when the context is changing and triggers actions within your team to adapt. So those are the benefits. Let's take you right into the content of waste. So waste is such a critical concept in the lean thinking approach. Waste is defined as any step or action in a process that is not required to complete the process. So when you apply the lens of a customer, and this may make more sense once you've applied that lens, waste is any action or step in a process that does not create value for your customer of your product or your service. So there are multiple types of waste. There are 8 types of waste, but because we want to get to the meat and potatoes of this webinar, I'll only discuss a few briefly. So first up, we have defects. These are waste from a product or service failure to meet customer expectations. So for example, in business, defects, which are also known as errors, could be from producing reports or marketing materials that are incorrect or they have some wrong information for the customer. And so here you would need additional resources to correct the error. And then the other issue is that you've given your customer the wrong information. So there you have defects, and what happens is because you have those defects, you have to then fix them. So that's the additional use of resources. That's what we mean. So with overproduction, another kind of defect is the waste from making more products than what customers demand, resulting in a waste of resources and time. Your resources can be materials that are used to produce the products and services, and that's also being wasted because you've created more of it. Additionally, it leads to unnecessary inventory in warehouses and also to the transportation of unnecessary quantities of your product or service to stores or warehouses. So those are all other additional types of waste that get triggered because of overproduction. And so in a non-manufacturing setting, this could be printing and filing of unnecessary documentation in an insurance claim where the insurance company already has the documentation in electronic form. So that's an example in a non-production setting. Now, another waste that you may all be actually familiar with is called waiting. It's easily recognizable because that's when you're twiddling your thumbs, waiting for the previous step in the process to complete. It can be waiting in the factory line for a slower task to finish before the next one can kick off. And in fact, the slowest, most time-consuming task is called the bottleneck. In an office setting, this can be employees waiting for approvals from their managers to finalize actions. So you're just waiting there. So with that, I want to take you to through another very important key concept, which is called standard process. So now that we've explained what waste is, we've defined what lean thinking is, let's start with identifying the process. So every process should have a standard. It doesn't matter if you're talking about a manufacturing process, like production of a good, of a car, or of some kind of garment in a factory, or it's an administrative process like customer service or registration, right? Every process has a standard. Now, the standard is a basis of comparison for abnormal to normal. If the standard doesn't produce the expected result, there is a problem. Lean is then about using a set of practices and tools, which we'll get to experiment solutions. Now, I'm not going to spend much time over here because what a process is pretty well understood by all. So this is just a visual on the screen. But instead, what I want to focus on is how do you identify your standard efficient process? There are a number of tools and steps, like I mentioned, that we'll take you through, but that's how you use to identify what is the normal, where are you an abnormal, and how you can meet those gaps. Now, one thing you can do is you can set targets for how much time a step in your process should take, how much it should cost. And to figure out your targets, you can either do some benchmarking exercises, or you can create your own values, your own process maps, and identify what both the time as well as the cost should be. Now, through these actions, you can then identify the gaps and the waste, which are the steps that you're blowing through on your targets, and Yuan will take you through an example later. Now, once you've identified which process steps are inefficient or ineffective, you can then design experiments to help you achieve your targets. And those are, again, like I mentioned, targets on cost as well as time. And so what you do over there is to design these experiments, you can use what's known as a PDCA cycle. That's to design and test the experiments. So let's take you through the PDA cycle. The PDCA cycle is a continuous loop of planning, doing, checking, and acting. So just as a circle has no end, the PDCA cycle is meant to be repeated for continuous improvement. It provides a simple and effective approach for solving problems and managing change. And this can be for an entire project, or it can be a small task within the project. It can be for one step in your process or the entire process. So the model is useful for testing improvement measures on a small scale before updating procedures and working practices. So let's start with the P, with the planning stage. This is where you are running diagnostics to identify gaps and abnormalities. This is also where you can define your goals and develop an action plan. Next up, you have the D, or the do stage. You're moving into action. This is where your employees are executing new processes. Next is the C, or the check phase. You're assessing the improvements and analyzing the results of the new process and steps. And in the act stage, you're implementing the better solution. PDCA can help you get from your current ineffective situation, so your abnormal process, to the target situation, that is your normal process, that you're aiming for. Now I'm going to hand it back to Heather, who will kick off our tool section.
Great. Thank you, Yakuta. A popular tool in Lean is the A3. It's called an A3 because that's the size of the piece of paper, it's 11 by 17 inches that all the information shown here is meant to fit on. The beauty of the A3 is that it tells a story from the upper left-hand side down to the lower right by laying out on a single piece of paper an entire plan to solve a problem or make an improvement. The A3 is a way to capture the PDCA cycle along with relevant contextual information. So here the contextual information includes the background, current situation, and the goal. The background section shares why of all the problems are we talking about this one? Well, the current situation section focuses on current performance and how work is done. It also includes a clear problem statement. And the goals section states what the end target condition or performance improvement is. Developing the plan, so the P in the PDCA cycle, consists of completing the analysis and recommendation section. The analysis component includes exploring what the root causes of the problems are. Like you can use here tools such as Fishbone or 5 Whys. You could also note in this section what requirements, constraints, and alternatives need to be considered. Whereas the recommendation section then outlines proposed countermeasures and strategies. Next, the do stage occurs when the plan is implemented. Here, the plan outlines what activities will be required for implementation and who will be responsible for what and when. And finally, the check and act stages are included in the follow-up section. This section includes information on how will we know if the actions have the impact they needed, what remaining issues are anticipated, when and how will we follow up. So what's important about the A3 tool is not the format, but rather the process and thinking behind it. An A3 can be used to make the case for change or experimentation. It's also a way to create understanding to lead to action. It basically displays how individuals see things and allows others to engage in conversation to discuss disagreements before the plan is implemented. It also encourages frontline engagement, or in Lean language, like go to the Gemba and see, which means like basically go and observe. And that kind of information kind of goes on the left-hand side in the contextual information sections I talked about. So thus the A3 works both as a problem-solving tool as well as a structured process for developing proficient problem solvers within your organization. So I want to move into a next slide to help illustrate an A3, which is, I'm going to share an example from a garment factory focused on a problem around worker tardiness. So let's start with the background. Of all the problems, why are we talking about this one? So here we simply state, garment factory's main customer wants to increase the size of their monthly order, but the factory productivity varies too much at this point to finalize the deal. So then we move into the current situation. And here we put 2 graphs, which are included to show the current performance via monthly data of the inverse relationship between worker tardiness and number of garments produced. As you can see, when tardiness is high, the production is low and vice versa. Additionally, in this section, we share how work is done by listing out the steps in 2 standard processes. The first is for requesting leave, and it demonstrates the chain of command for approvals from the supervisor to floor in charge and finally HR. And the other outlines the standard process for reporting unplanned absences or tardiness. And the current situation section concludes by outlining a clear problem statement, which is worker tardiness is reducing productivity. So moving on to the goal section, here we note the target condition or performance improvement the factory is aiming for. In this case, it's that they want to reduce worker tardiness to less than 5% per day. In order to discover the root cause of the problem in the analysis section, a 5 Why exercise was conducted. This analysis concluded that workers felt like they're not critical to the factory goals. So then we're done with the left-hand side of the A3, which outlined the background and the problem. And now we're going to move to the right-hand side of the A3, which focuses on action around what are we going to do about this identified problem. So the recommendation section outlines proposed countermeasures and strategies to reduce worker tardiness. These include calling workers if they're tardy, as well as implementing morning meetings to discuss targets for the day and the impact of the prior day's performance on productivity in order to encourage accountability with workers. And then they begin to understand how their role fits into the broader goals of the factory. You'll notice benefits of implementing each countermeasure are included, such as improved quality, cost, time, and/or safety. And here it's also important to clearly state who is responsible for implementing each countermeasure. Next, the plan section outlines activities, including their timing required for implementation. So for example, in Q1, they'll coordinate logistics for countermeasures and socialize the upcoming changes. Q2, they're going to implement those changes mentioned above. And then Q3, they're going to review the impact of changes on worker tardiness and productivity in order to act accordingly. So it kind of really simplified it for this example. And then finally, the follow-up section then notes how they'll track if the actions have the desired impact. This includes monitoring and sharing daily, weekly, and monthly tardiness per factory and effect on factory productivity, as well as reviewing progress towards their goal during Q3, and then assessing if additional countermeasures are needed. And so then at that point, if they realize they still haven't met their goal, they'll probably start a new A3 and think about, okay, what other countermeasures do we need? Did we get the root cause analysis wrong? What's going on? What do we need to hone in on? So that's how you just keep doing a PDCA cycle continuously to reach your goals. So here I'm going to turn it over to Johan to share some more on process mapping.
Thank you, Heather. So I am going to bring up, just give me a second here, and I will, we're just switching over from the presentation that you've been watching to the process map, so I can show you that in more detail. Okay, there we go. So what we're going to talk about is we're using a healthcare example to illustrate this, but really process mapping is applicable in pretty much any industry where you do something, and we all do something, right? So in this case, it's a service-based industry, which is, delivering patient care. So it's intended to show you kind of what process mapping looks like and how it's applied if you perhaps haven't used process maps before. So the concept of process mapping is really very straightforward. It's just you break down, you talk to the people who actually do the work, you ask them what they do, and you kind of map it out so that you've got a visual representation of the work being carried out with all the various tasks and steps that people do when they're carrying out the particular process you're examining. And then we list for each one. I'll give you an example over here. Register the patient. We list what the task is. We list who does the work. In this case, it's the medical receptionist. And depending on the type of process mapping you're doing, sometimes you want to know what the time is for that task, and sometimes you don't. For the kind of work that I'm teaching here at the Institute, we typically do want to know the time, so we include it here. Now, just to give you a little sense of the standard notation, there are conventions in process mapping. Sometimes they vary a little bit, but there are multiple different symbols used in processes, but these are some of the most common ones. There's a start point, and over here there's an end point for the process map, and these are typically shown with a green circle. And then for each step, actual task that's undertaken in the process map, that's typically shown as a yellow square. Basically, when you're mapping out these processes for the first time, you typically don't do it straight into software. You actually do this on a whiteboard or on you can line a wall with some large pieces of paper, and you're pretty much putting sticky notes up, because as people tell you about the work and what they do, you as the person conducting the seminar, getting information, you can move these process steps around. You've got a small number of people in the process, you can bring them up to the board and they sit there and move them around with you and tell you, oh, I do that, and then so-and-so does this. And you figure out what the work process currently looks like. So each task is typically a yellow square, and then blue diamonds, which are simply a sticky note turned 45 degrees. Blue diamonds are typically represents decision points where you're actually asking a question and the process can go one way or another depending on the outcome of that question. So in this very simple example, it's a patient arriving for an eye examination at a center that does eye surgery. And the intention of the process is to determine whether the patient has a cataract or not. You don't need to know the details on that. It's just in principle, but a cataract is a medical condition of the eye, typically as you age, and it can cause blindness, and it is completely curable with surgery. So it's important to make the diagnosis because people can go from being blind to being able to see with a simple surgery that takes about 15 minutes. So it's an important diagnosis. This particular example was in Mexico. And the reason we used it is they actually quite strongly re-engineered their process and made the cost of care a lot cheaper at this particular eye center. So, so in this case, patient arrives, you figure out if the patient is registered or not. If the answer is no, then you basically, there's a retest, because it then says what you should do. You should register the patient. You then retest your decision point to see if that has changed. Now, is the patient registered? Well, if you've carried out this action, the answer is now yes. You can move to the next step in the cycle, in the process. I'm not going to take you through every step in the process. That would take up too much time here. I just wanted to show you the principles. So you go through the next decision point. Basically, the patient ends up seeing the doctor. The doctor finds out the story of the patient's problem. The doctor examines the patient. And then I'm actually trying to show you the as-is process. I beg your pardon. So they examine the patient. They determine if the patient has a cataract or not. If the answer is yes, they discuss surgery and so on. And then you conclude the consultation, and then there's scheduling of the surgery and moving on to generate an invoice. I'm not, dwelling much on the details here. I just wanted to show you the principle of each task is mapped out. Each decision point is mapped out. With each task, the person performing the task is allocated to that task, and the amount of time that person spends there is allocated. Now, I'll show you when we look at the 2B process why that's important and why you can actually bring about quite large efficiency gains if you analyze the process in this way. Now, the question is, how do you go about analyzing the process? The answer is that you apply a number of filters to that. You typically look for frustration points. You look at how much time the process takes. You look at the cost of the process, and you look at quality within the process. In this particular example, we're not going to dwell terribly much on quality, but there were a number of frustration points found. Patients, they want the price to be cheaper. The 2B process, the future process, actually figured out a way to do that. They don't like having to wait to get an appointment. They don't like having to wait in the waiting room after they get there. For the doctor, they're spending a lot of time consulting with patients when they're actually also trained surgeons. So they would prefer to spend time doing surgery because quite honestly, it pays them better. And then for the business, having a doctor spending a lot of time consulting when perhaps somebody else could do some of that work and the doctor could concentrate on surgery represented a lost revenue opportunity. So there were a number of frustration points. That's usually a good way to find how to improve your process, is ask people what is frustrating them. And then we look at the time for the process here is just over 2 hours. There was an hour and 15 minutes of the doctor's time because they were doing most of the work. And doctors are typically your most expensive people in a healthcare process. So when you look at the cost, you give an example. These are roughly the right numbers for the US. Other markets have different costs, but doctors cost about $6 a minute on average. That is not what they're getting paid. That's their pay and benefits plus the equipment, the cost of the equipment they use, the cost of the space in which they work, and so forth. So all of that is combined into a single permanent cost. And a nurse is about 1/5 of that cost, and an administrative clerk is about 1/10 of the doctor's cost. So if you can allocate tasks away from an expensive person to a cheaper person who is still qualified to do the work, that is one of the ways you can save money. And it's one of the key aspects in healthcare. That's often where there are savings to be had, because healthcare is a very labor-intensive service industry. So what we looked at there is called the as-is process. It represents the workflow and process as it is currently done, so as it is. Now, when you determine how you might want to improve a process and how you might want it to be done in the future, that proposed new process is referred to as the to-be process. It's the process that's going to be implemented in the future. A lot of it looks very similar to what we had before. And just so you can get a sense, I'm going to zoom out and just show you the two processes side by side. I know you can't read the writing when it's this zoomed out, but you can see that the map changed a tiny bit. It's about the same up to the first decision point. After that, there was an additional decision point introduced, and the order of tasks changed very slightly. What really changed in the to-be process and made it substantially cheaper and easier to execute was who was doing the work. So there was a lot of task shifting, it's called, where you shift a task away from somebody who's more expensive to somebody who's less expensive, but still within their license. So we call it the principle of operating at the top of your license, So for example, for obtaining the history from the patient, instead of the doctor doing that, in this clinic, they changed it to an ophthalmic technician, who's someone who has a couple of years of training at a technical level. And they're actually, the questions you need to ask are very standard. So they actually had a script of standardized questions that they would work through with the patient. So they had a protocol to work to, and they could obtain the information that was needed. The examination of the eyes was then carried out by an optometrist. Optometrists have about, depending which country you're in the United States, it's a postgraduate training. So it's a 4-year training after you have a bachelor's degree. In many countries, it's a 4-year training straight, or a 5-year training, depending on the country, straight from high school. But they are nonetheless cheaper than ophthalmic surgeons. They're not full-on medical doctors, and they've not had all the expensive training for surgery. Their job is just to make diagnoses. And so that already took down the cost of seeing the patient. What they did do is they actually operated multiple consulting rooms at this clinic. So you had at least 5 consulting rooms running, each one having a technician and an optometrist seeing patients. And then there was an ophthalmic surgeon or a fully trained doctor who's an ophthalmologist or eye specialist floating in the clinic, who could then see any of the cases that were more complex, that maybe needed a second opinion from a fully qualified surgeon. Usually that was around 5 to 10% of the cases in a day. So they still had a big saving because they were not having to pay an ophthalmic surgeon to have a look at every single patient. They would determine if the patient had a cataract or not. For discussing surgery, again, they took that task away from the doctor and allocated it to a counselor. So they had someone that went through extensive in-house training and learned how to discuss with patients. I mean, they were both a psychological counselor and also, quite honestly, in a sales role. They were trying to figure out if the patient needed surgery, and there were various cost options for this, because most of these patients were quite low-income patients who did not have healthcare insurance, and would typically be seen by the public system, but the public system was not able to supply all patients their needs. And in Mexico, there were about 2 million people with blindness who could be cured by surgery, who were simply not getting served by the public hospital system. So then again, scheduling surgery was done by the counselor. Conclusion of the consultation, again, instead of the doctor, it was done by the optometrist or counselor. It could be done by either one. and then administrative folks carried out the bookings. So they largely took the doctor out of the consultation process, other than for the most complex cases, and concentrated the doctor's time and energy on carrying out surgery. They also quite heavily re-engineered their surgical processes to make those more efficient. Interestingly, this is a medical business, but the founders were actually two highly qualified engineers who then, basically brought their engineering expertise to process improvement in healthcare. Outcome, they actually reduced the cost of both the consultation and ultimately the eye surgery. In fact, the consultation came down about 75% versus a typical cost of a consultation with a specialist doctor. But really what was more important was that they brought down the cost of the surgery by about 50%. Versus what anybody else was charging in Mexico at the time. And this made it a lot more affordable for people who otherwise were not able to afford surgery in the private sector and were on very long waiting lists that effectively meant they were not getting served in the public sector. So that gives you a sense of some of what you can do with process mapping. As a quick footnote, you can then use time-driven activity-based costing, which we're not going to get into today, but just to say it's a method by which you can calculate the cost for each minute of work done by each of the different people, whether it's a tech, an optometrist, or a doctor, and you can multiply the time they work by the cost of their time, and with that you can figure out the cost of the entire process as it currently is and as you think it will be, and you will know ahead of time before you even try to implement your process what it's likely to cost you, to see if you're having a cost saving or not. So thank you very much. I hope you found that interesting. I'm going to hand over to my colleagues again and stop my screen share so they can go back to the presentation. Thank you.
Thank you very much, Johan. So now that you've learned about lean practices and tools, where should you start? We recommend start by identifying a standard process that creates value. It doesn't matter if you're talking about an administrative process like customer service or a manufacturing process like production. And if a standard doesn't exist, create one so problems can be identified and experiments can begin. As Yakuta mentioned earlier, a standard is a basis of comparison for abnormal to normal. And if the standard doesn't produce the expected result, then there's a problem. And that's where you start using some of these tools we talked about. Next, you'll monitor the process for problems identified by yourself and the broader team. And then once the problems are identified, you'll ensure a timely and positive response to those that identify the problems. This brings up the question, so what should workers do when they come across a problem? You could use a signal or and-on in lean speak, like a whiteboard for workers to write down problems they're experiencing. And the supervisor could then check that board once a day. I mean, on the Toyota production system line, you can pull something or push a button and the whole line stops until the problem's solved. But I think for some of these other types of processes that we've talked a little bit about today, a whiteboard could perfectly serve that signal, perfectly serve the purpose of being that signal system. Once a problem's brought up, the worker should then get a response from a supervisor in a timely and in a positive manner. So then once the problems are identified, then you need to work together to solve the problem. The supervisor should not tackle the problem themselves, and rather they should teach problem-solving mechanisms to the team in order to build that capability. This can be done by involving the team and using some of these lean tools we talked about. So a good tool to start with is creating a value stream map like the one Johan shared for the identified process. And then using an A3 like I shared to create your hypothesis of how to make things better by eliminating waste and creating more success. Then go ahead and implement countermeasures and conduct experiments. Share the results will help achieve quick wins and build buy-in for continued use of lean practices and tools. And then act and make changes to the products and services and operations in real time based on those findings. After you've done all that, you can make a case to leadership and seek their sustained buy-in for using lean practices. And lastly, we recommend formalizing a continuous improvement agenda. Such an agenda can help you prioritize and organize problems that you want to focus on based on the company's broader strategy and needs. The agenda can also help ensure that knowledge gained from the completion of each A3 is disseminated, which will then help reinforce a learning culture within your organization. We also have 3 additional tips. Number 1, everyone wants to start with someone that's in charge, the CEO, or they want to start with education or benchmarking, but the latter doesn't really work without action, such as experiments. So it's important to just start where you are, regardless of your role in the organization. Number 2, bringing your team together on this journey will build problem solvers. Indeed, the PDCA cycle is a way to listen and work together with your team to solve problems. And number 3, as a reminder, the systems thinking that underlines lean includes 1, having standards, 2, using a signaling system to flag problems, 3, providing a consistent, timely, and positive method of response when problems are raised, and then 4, working together on problem solving rather than having individuals firefight problems on their own. Now we want to leave you with some indicators that are commonly used in lean. First off, we have lead time. This is the time between the start and end of a process, or in other words, lead time measures how long it takes to complete a process from beginning to end. For example, in production processes, lead time is calculated by adding the number of days to procure materials, manufacture goods, and then deliver finished products. Next up, we have throughput. Throughput is the number of units that can be produced by a production system within a certain period of time. It's a crucial metric for evaluating the performance and capacity of your standard process. And then, of course, Net Promoter Score, which is a key customer-centric indicator often used by marketers. A Net Promoter Score measures customer satisfaction. At WDI, we use lean tools as well as other tools to help our partners diagnose problems, develop solutions, and then test and evaluate those solutions. Some example tools we use for each of these stages is listed at the bottom of this slide. At WDI, we're lucky to be able to work with both the private sector as well as the public and nonprofit sectors. We often serve as a bridge between these sectors, as each has their own common tools and terminology that often does not translate directly to the other, and we feel lucky to understand both sides and to be a middleman that can help with that communication. For example, the private sector tends to utilize different measurement techniques compared to the public and nonprofit sectors. The use of Toyota Production System's lean methods is commonplace in the private sector, whereas the use of monitoring, evaluation, and learning, or MEL for short, is standard in the public and nonprofit sectors. A few years ago, we wrote a white paper where we share ways each of those sectors can improve their organizational performance by adapting aspects of the other's measurement practices. The white paper, Improving Organizational Performance Through Cross-Sector Learning, Lessons from Measurement, can be found on our website. We're also happy to email it to you if you email us. So we want to thank you for joining us today. If you'd like to talk more about lean practices and tools, or for a copy of the white paper I mentioned, please email us at wdi-performancemeasurement@umich.edu. And now we'd like to open it up to our Q&A portion. We'll say Lorenzo asked if the slides will be shared. Happy to share those. Just shoot us an email at wdi-performancemeasurement@umich.edu and we can send those directly to you. Do we have any other questions? Oh, I see. Oh, yes, I'll write the email here. Yes, it is a long email, performancemeasurement@umich.edu. Great. Yes, and the recording, another question just came in about the recording. We do plan to make the recording available. We'll be putting it into a Next Billion post. We mentioned Next Billion at the beginning. So stay tuned, and that will be there in a month or so. If you do want it, the recording beforehand, just send us an email and we can figure something out. Lorenzo, you asked a good question. What about culture at the workplace? How do you face it? I'll start by answering and then I'll see if Johan and Yakuta have anything they want to add. I think culture at the workplace and how do you face it in terms of, I'm going to assume you're meaning in terms of how to socialize some of these lean tools and make them part of practice. And this is what I was trying to get at in saying, it can help for anyone within the organization to just start using some of these tools and then bring others alongside them on the journey of it and then show the results like, oh, we used an A3 and look what we were able to accomplish, and show those results to others on the team and then start spreading the word a bit more so that others can see that these tools work and they have a benefit. We also had suggest using a learning agenda of sorts. So there's where you can start to prioritize which problems you tackle, because workplaces have lots of problems. So how do you decide which ones are the most important to tackle, or what's the most strategic to tackle initially? What aligns the most with the company's strategy, or maybe key decision makers, things that will make them more interested in having this culture change around learning. I'm going to see if Johan or Yakuta want to add anything else.
Yeah, I'm happy to give you a little bit more. I mean, I'd say, I mean, I've been involved with many of these projects, not just here, but in previous work as well. And I worked for a while for KPMG, and we did quite a bit of, business process improvement for clients, which uses basically the same techniques. It was, how well this was adopted and how successful it was directly correlated with the level of seniority of people in the organization who said they liked it. So the example that I gave there of this Mexican company that reimagined, their processes for ophthalmic consultations and ophthalmic surgery. I mean, it was built into the DNA of the company from the very beginning. The founders wanted to find a way to do stuff better. There've been a few other examples of organizations like this in healthcare. Actually, many examples of these organizations in healthcare improving this stuff, and it gets widely adopted if senior leadership either asks for it to begin with. They don't need to know all the fine details of how to do it, but if they say, look, we want to improve our processes, and kind of give the endorsement to whoever is then in charge of leading a process improvement project. So if you're kind of mid-level in your organization and you want to do this because you can see its benefit, I would suggest spend some time selling the idea to people who are above you, who can endorse it for you and give you support to take it wider in your organization. You can take something that you work on, or an immediate group of people, and do a little pilot there that demonstrates it. And if you are a senior person yourself, you have the opportunity to to kind of really bring this into your organization. So yeah, bottom line is it typically needs some senior support, and if you have it, it can be very, very successful.
Yeah, and the only thing I'll add to all of that is that lean thinking, it does require a cultural shift, right? And we've talked about it throughout the presentation, starting with the fact that this is a data-centric system-based view. And so you right over there, right? Are you a data-centric organization? If you're not, you have to think about that. Then we've talked about the Gemba walks. Heather mentioned that. That's where leaders walk through the factory floor and are interacting with folks that are much junior to them. So again, if that is something strange where there's lots of hierarchy and the layers are not talking to each other, that's again another cultural shift. We talked about customer-centric focus. More than anything else, it's about putting the customer at the center, understanding what value means to them, going to them, asking them the questions and getting their feedback. Again, that's a cultural shift. I mean, I can go on there, like the different events, like even putting together the value stream map or the process map is about bringing the teams together. Do they talk to one another? Are they just sitting in silos? The focus on waste on understanding what waste means, and including that, and of course empowerment, respect for people. These are all part of the lean thinking culture, and in fact, respect for people is a core principle of lean thinking. So yep, that's all I'll add.
Great, thank you. We have another question. What about gray power positions within the organization? Like complexity helps this, so sometimes middle managers are against certain improvements because they feel they might become less relevant. Here, I would just say, I think this is where prioritizing which problems you tackle first can make a big difference. Because especially depending on where you are positioned within the organization, you've got to kind of sometimes get buy-in from a middle manager as well as more senior managers. And I think you've got to think pretty strategically about which problems you take on first. And I think here, if you align what you are trying to solve for with what the company's goals are, then that should help you be better set up for success. Like, where is the company trying to go? How is what problem you're trying to solve for related to those goals? I think then it becomes a little bit easier, but I understand the challenge here. I'll see if Johan or Yakuta have anything they would like to add here.
Yeah, it can sometimes be a real challenge if you've got folks somewhere in the middle who think that a particular process improvement or lean initiative is a threat to their jobs. Again, that's where you've got to have that senior buy-in to drive the whatever process you're trying to do in an organization. A lot of the time it turns out not to be a threat to people's jobs, but people easily perceive that it could be. And you have to get the right messaging out there as to why the company wants to do, or the organization wants to do this. And again, senior buy-in. If someone reporting to a particular manager tries to do this and that manager really doesn't want this, it's probably not going to happen. It really does come into kind of getting that support at the most senior level you possibly can in an organization, and then before undertaking initiatives. It doesn't just apply to lean; it applies to a lot of things where you want to undertake something new that changes the daily sort of status quo in an organization. And there's a whole, that's why consulting firms also sell change management and stuff like that, because there's a lot of complexity around doing this, and a lot of it really just boils down to senior support and a lot of communication.
Yeah, maybe, I mean, I don't have anything more to add, but I was just going to drop in a joke. Maybe you're the middle manager who brings lean before you get cut. Bad joke.
Well, great. I see we're almost at time and I don't see any more questions, but we really want to thank you for sticking with us through the hour. We enjoyed sharing more about lean with you. And if you ever want to chat more about it, really feel free to email us. We'd love to talk more with you. Thank you again.
Thanks, everyone.
Thanks, everyone.